This video is for women who are considering having an abortion and are less than 12 weeks pregnant. We will be going through the following: different abortion procedures, care you can expect to receive, and possible complications. This information aims to help you and your healthcare team make the best decisions about your care. It may help you in deciding whether abortion is right for you. You should still seek advice from a doctor or nurse about your own situation. What is termination of pregnancy? Also known as abortion, this term refers to ending a pregnancy through prescribed medicines or surgery. Abortion is a safe procedure for which major complications are uncommon at any stage of pregnancy. The earlier in the pregnancy the woman has an abortion, the safer it is. In Singapore, the law allows a woman to obtain an abortion up to 24 weeks of pregnancy. Singapore's laws on abortion are encapsulated in the Termination of Pregnancy Act of 1974, which is as follows. This act states that every treatment for terminating pregnancy shall be carried out by an authorized medical practitioner in an approved institution. Termination of pregnancy can only be carried out for a citizen of Singapore or the wife of a citizen of Singapore, a holder or the wife of a holder of a work permit pass or employment pass, or a person who has been resident in Singapore for at least 4 months, unless it is immediately necessary to save the life of the pregnant woman. However, no treatment for terminating a pregnancy of more than 24 weeks can be carried out unless the treatment is immediately necessary to save the life or to prevent grave permanent injury to the physical or mental health of the pregnant woman. Pre-abortion counselling must be provided for a pregnant woman regardless of her marital status. The Act requires the pregnant woman to sign a declaration that she has been counselled, and there is a mandatory waiting period of 48 hours after the counselling before the procedure can be done. A decision on abortion is never easy. In order to solidify the pregnant party's decision, the healthcare team should make sure she has accurate information about the abortion procedure. The woman should be given information on the different methods of abortion that can be used at different stages of pregnancy and the possible complications associated with them. Extra support should also be offered, including counselling if needed, to help with the decision-making. She can also change her mind about having the abortion at any stage. If she decides not to have the abortion, she should still be offered information and support. The healthcare team should ensure that she can get help if she has additional needs, such as if the woman does not speak English. The woman also has the right to delay or cancel appointments. The pregnant woman should be offered a blood test to check her blood group and a blood test to make sure she's not anemic. Tests for genital infections, including chlamydia trachomatis or other sexually transmitted infections, and an ultrasound scan. Before an ultrasound is undertaken, she should be asked whether she wishes to see the image or not. She will have an opportunity to discuss with her healthcare team her plans for contraception or birth control methods after the abortion. What does an abortion involve? An abortion is a way of ending an unwanted pregnancy using either medicines or drugs called a medical abortion, or using a surgical procedure also known as surgical abortion. Medical abortion in the first trimester can only be conducted up to 10 weeks of pregnancy. The pregnant woman will need to attend the clinic or hospital to collect 2 different medicines. The first medicine she will be given is mifepristone, which will block the hormones to the pregnancy. She has a choice to take this medication in hospital or at home. This tablet is taken orally. 24 hours after taking the first medication, she will be given the second medication to take home. The second medication, misoprostol, makes her uterus expel the pregnancy, usually within 4 to 6 hours. This medication is taken buccally, which means placing the tablets in the mouth between the gum and cheeks. The pregnant woman will also be given detailed instructions about when and how to use the medication by her healthcare professional. She will be offered pain relief during the abortion because she may continue to bleed for a few days. Suction termination is usually used during week 7 to week 12 of pregnancy. If a surgical abortion is chosen, the procedure is usually conducted under general anesthesia. The cervix or entrance to the uterus is gently stretched and opened. The extent to which the cervix needs to be opened depends on the size of the pregnancy. It is stretched until it is wide enough for the contents of the uterus to be removed with a suction tube. Abortion at any time in pregnancy is a safe procedure for which serious complications are uncommon. However, it does not mean that there are no risks. The side effects of medical termination of pregnancy include nausea, vomiting, fever, shivering, diarrhea. All these symptoms make up 60% of the cases with complications. Less common complications of medical termination of pregnancy may include retained products of conception. This means that some pregnancy tissue may be left behind in the uterus, requiring surgical evacuation of uterus. Failed abortion requiring another method of abortion. These cases make up 4 to 5% of all cases. Rarely, a recent abortion may cause complications such as bleeding requiring blood transfusion, infection, or, in extremely rare cases, the pregnant woman may suffer from uterine rupture. Complications of surgical termination of pregnancy may include infection and retained products of conception. These complications usually apply to 1 to 5% of the patients. Rare complications of surgical termination may include damage to external cervical orifice, uterine perforation, failed abortion and continuing pregnancy, or excessive bleeding. These cases usually affect around 0.1 to 1% of the patients. In even rarer cases, complications may occur, which include anesthetic complications, injuries to bowel, bladder or other organs related to uterine perforation, Asherman's syndrome, or cervical incompetence, which refers to weakness of the neck of the womb, causing problems such as premature cervix dilation in subsequent pregnancies. In extremely rare cases, it may even lead to death. There may be additional risks with undergoing multiple terminations, which the doctor will discuss with the patient if applicable. After abortion, patients may experience mild lower abdominal cramps 2 to 4 days after the procedure, which can be treated with oral painkillers. Light vaginal bleeding up to a week after the procedure. To reduce the risk of infection, the formerly pregnant woman should refrain from vaginal intercourse or tampon use 2 weeks post-procedure. After the abortion, patients should be offered return advice to see the doctor urgently if she has any of the following symptoms: fever, foul-smelling discharge, heavy vaginal bleeding, and/or abdominal pain. Patients should also be given the chance to discuss contraception and obtain supplies if she needs them. A follow-up appointment within 7 to 10 days of the abortion can be made, during which pregnancy hormones are checked if she had an early medical abortion. Another follow-up at 6 to 8 weeks may be required to check for return of menses. Further counseling should also be provided if the woman experiences continuing distress. This can happen to a few women and is usually related to personal circumstances. Can a doctor refuse to give the abortion? A doctor or nurse has the right to refuse to take part in abortion on the grounds of conscience, but he or she must refer the pregnant woman to another doctor or nurse who will help. Will anyone else be told about the abortion? The pregnant party has a right to confidentiality. She does not need her partner's agreement to have an abortion, although many women want to discuss the pregnancy with their partner and come to a joint decision. Partners who have taken legal action to try to prevent an abortion have so far always been unsuccessful. What if the pregnant woman is under 16 years of age? It is mandatory to refer an unmarried girl below 16 years of age for pre-abortion counseling at the Health Promotion Board Counseling Center when she seeks termination of pregnancy. A certificate of attendance will be issued to her by Health Promotion Board Counseling Center. No termination of pregnancy can be performed unless the certificate of attendance is produced by the girl. What if the pregnant woman's blood group is rhesus negative? If the woman is rhesus negative, she should usually be offered an anti-D injection after the abortion. How would the formerly pregnant woman be affected emotionally? For most women, the decision to have an abortion is not easy. Most women will experience a range of emotions around the time of the decision and the abortion procedure. An abortion will not cause her to suffer emotional or mental health problems in itself, but if she had mental health problems in the past, she may experience further problems after an unplanned pregnancy. In this case, she should speak to the doctor about her concerns. Thank you for watching this video. This video is presented by Yonglulin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.